Welcome to In Search of Value from Mingle Health. In this interview series, we'll explore the transition to value-based care from the perspective of individuals inside the healthcare system. Here are our hosts, Allison Casaccio and Charles Howes.
I'm looking forward to the conversation today. It's with our colleague, Roxanne Thacker. She's the Vice President of Managed Clinical Services here at Mingle Health. I'm excited because she has this unique position as a pharmacist who's decided to step out of that role and work to help folks navigate the transition to value-based care. She shared how she likes to kind of step out of that patient visit, step out of the patient room and understand the context of how the patient's engaging with the system. Not only the provider, the clinic, but also, what's going to meet their needs and what needs do they have that might not be obvious on the surface. So I'm really looking forward to the conversation.
Yeah. It can sometimes be unique for providers that move into a more analytics-based kind of role for them to stay so uniquely patient-focused. And one of the things that I really value about Roxanne is that she brings the humanity of healthcare. In a way, she brings it to big data, right? So she keeps the human element in it, and I think that's really valuable. It's one of the reasons I like interviewing her.
Yeah, one of my favorite parts of the conversation was Roxanne, really encouraging everyone to find their sphere of influence, and that really is likely right in front of you with the patient that you're seeing or the clinician that you're mentoring, and how not only does that make a big difference for that person, but it's also a critical component of the system. And if the system's going to really provide care to all of us and have value to the patients, that's what it takes. It takes that focus of who's right in front of you, and how can you make an improvement right then to be part of the bigger change.
Yeah. I think the best interviews for the healthcare industry are a good combination of pragmatic tools and inspiration, because it takes that little bit of a spark to go back to our home practices and make those changes. So I think Roxanne will bring that.
Here. Let's get to it. Thank you so much for joining us for the conversation, Roxanne. We get to work with you every day, but it's a special opportunity to kind of dive into your background and hear more about how you came to Mingle Health and got involved in healthcare. One thing that I wanted to start with is you are a preceptor. I don't know a lot about that process, but I would love to, as I understand it, it's all about training new pharmacists, medical personnel. So I'd love to hear from you, how do you introduce yourself to those folks who are you're working with as a preceptor when they first meet you?
Yeah, that's kind of a fun question. Generally, I introduce myself with what my historical professional experience looks like, and generally, I would say, "Hi, I'm Roxanne. I have worked in a number of different sites and in a number of different areas, and all of it has the potential to benefit you if, as a student, you are curious and want to know more." I have taught technicians, I've taught pharmacy students, I've been in presenting situations, I've been inpatient, outpatient, doctor's offices, consulting roles. Now I've been in analytics and government reporting, value-based care. I did research for a little while, not my favorite thing, but I do know a little bit about it. And I've also worked as part of the team in a youth center. So I've done a lot of different things, and sometimes just being able to ask someone questions about what that environment was like can be really helpful for students. I also tell them that the most important part about being a student and being a preceptor is I'm here to ask questions to help you to learn, and you're there to ask questions to help your learning too. So the whole interaction of precepting a student is based on questions and learning. If you're not asking questions, you're not learning. And if I'm not asking you questions, I'm not helping you to learn. So it's totally okay to say you don't know, which is also part of the learning process.
I love that. As the non-clinical person on this call, I ask a lot of questions, and you are a great resource, font of knowledge, as they might say. Um, Allison, I'm sure you have some questions too.
I do. Roxanne, I'd like to start with a little section just about you and your experience to really help our audience get to know you and your perspective. Can you tell us, how did you get involved in healthcare, and maybe a little bit about your current role?
Sure. So when I was in high school, I really loved healthcare and thought I wanted to be a physician. And one of my really, really dear friends was a physician at the time. She still is a physician. She's now retired, however. And she invited me to come and spend some time with her. And she was in primary care, which is what I really thought I wanted. Went and spent some time with her. And, after the day, several days were done, she'd say, and now I'm going to go home and do charting, or now I'm going to go home and do fill in the blank, or now I'm going to go home and, try to disengage from that primary care. And I love and respect her dearly, but I wanted a little more freedom than that. And I decided that I could do a lot of good by being a pharmacist and learning all of the things to support that relationship, and even to have patients of my own that I'm taking care of in that relationship as part of the team. For me, that fit better with my personality. The other thing is, I really don't like touching gross stuff. And so being a physician probably should not have been my job. I'm much more comfortable in a sterile environment, wearing clean room garb, dealing with patients where I'm like not putting my hands or anything on people. It's just not my thing, which sounds a little crazy. And so anyway, that's how I landed there. As far as my current role, I was actually supporting the development of our product called Check in a more consultative role. And as a result of that relationship, I got recruited to work for Mingle to help continue to build the Check product and also to implement it across other provider sites and in other care settings.
So, what's been your most meaningful learning across your experience?
I think the most meaningful learning for me is I can learn anything and I can teach anything except caring.
Oh, I love that. So what's the best part of your job? What keeps you coming back every day?
Oh, that's a fun question. I love the diversity of what I get to do. I have so many different concepts and teaching opportunities and opportunities to facilitate learning across so many different groups of people, everything from medical assistants and, our internal consulting team, physicians, group directors, analytics, informatics. I get to experience and interface with all of them. And every time I do, I'm learning something new from them. And it just really creates excitement for me of what new things I'm going to learn or what questions I'm going to be asked that I get to learn more about and get to share.
Okay, here's one I really like. How is your perspective unique, and how does that help you in your work?
That is a really good question. I think my perspective is unique in that I can separate myself to a large degree from the day-to-day hands-on in the room caring for the patient to focus more on process and what is happening leading into that room or what happens out of that room. It also has really benefited me to have a lot of the same background knowledge that a physician or a nurse might have, even if I haven't physically done whatever, I haven't ever done a surgery and I haven't ever, placed a catheter. but I understand all of the details before, during, and after. And so some of the hangups, then I don't necessarily come with some of the same concerns, but at the same time, I can hear those concerns and navigate them in a little different fashion. Or I may think of doing things in a different way that by training, it may never have occurred to you to do it that way.
Building on that, your ability to kind of step out of the room almost, you don't have the patient right in front of you in that exam room. It's giving me a lot of insight into the work that you're helping us do here at Mingle, where you're thinking about how we engage patients outside of that visit, annually, or when there's a complaint being presented. I'd love if you would just kind of share maybe an insight you have from helping, a care team see that as well, and, what they may have noticed.
So one of the things that I'm really proud of is our work with annual wellness visits. And often the hang up is, how do I get through, 100 questions with a patient in the limited amount of time that I have? I think being able to say, patients answer questionnaires all the time. They do this independently. What about calling them in advance? What about, trying to create different ways of connecting to patients is a lot more straightforward for me, because I don't feel like I have some of the process debt that some people come to us with. I'm a neutral party. I don't know what's worked. I don't know what hasn't worked, but let's talk about different things that I'm seeing across a whole nation worth of practices. I think that really helps. I think recognizing too that I have a dad who I am medically responsible for also has changed my perspective a lot about how patients receive care, how caregivers support the patient, and what that needs to look like, not only from the care team side, but also from the family side. And that has really changed my world a lot in the last 3 years.
Allison, you had an easy one for Roxanne.
Yes, I have an easy one. What's your favorite recent success story? Whether that's you, a customer, other experiences in healthcare, just a recent success.
That's great. One of my favorite recent success stories was with one of my care managers, and she had reached out to a patient at one of our practices that we support with care management. And the patient was really struggling because her husband couldn't get her all the care that she needed. She needed a wheelchair, and she needed a walker, and she needed a way to get them in and out of her car. They needed to be small enough that she could be mobile. And they hadn't been able to get any of that equipment. And with just a couple of phone calls, my care manager was able to manage that for them and make it so that she could go out to dinner with the other ladies that she liked going to dinner with. And it gave her the flexibility to feel like she could go to church, because that was something she was missing and felt like she couldn't stand in the line at church. And so she really needed that wheelchair. But at the same time, she wanted the mobility of a walker to be able to walk when she could. And while that doesn't seem hugely impactful across, the hundreds of thousands of patients that we see, to that sweet lady, it sure meant a lot.
Wow. Thank you for sharing that. I have a dear friend who's in their 70s, and that snapshot of, seeing their life before and after illness, and maintaining their independence. You can't take the human out of healthcare. And it's moments like that it's easy to forget when you're looking at analytics and new programs and payment processes and data. And at the end of the day, it has to be, for a reason. And that's, to provide value and help these patients, live a fulfilling life.
I have one last question that's just about you, and then I want to talk about some healthcare stuff.
Sure.
If you could go back to the start of your healthcare career and give yourself one piece of advice, what would it be?
That one's easy. for me. And that is to always be curious. And it is advice that I got from a mentor early on. And I think it has really changed not only my professional life, but my business life, my personal life, because I have really focused personally and professionally on always being curious.
I love that. So I want to talk about healthcare a little bit.
Sure.
I want to talk about value-based care a little bit. What does that mean to you? What does value-based care mean to you?
Value-based care, in my mind, is coming to a point and a place where for every dollar that we invest, we get at least $1 out in outcome. And if it's not doing that, it is not a value. If we are putting a whole bunch of money in and it's not changing anything about the outcome, that's not value-based. We're paying for something that doesn't get us anything. Sometimes that's what it feels like with gasoline. But we've just got to be sure in healthcare and where we are in healthcare right now, are we putting the money where it makes the most sense and where we're really getting the outcome that we want?
Yeah, that's so important. I remind my teenager, work smarter, not harder. And in healthcare, we need it all. We need all the effort for sure. But we also, at the end of the day, trying to make sure that the outcomes improve and that value is being delivered. It's critical.
Some of that is in human cost too. And that's really hard to measure. If patients feel heard, if patients feel cared for, if patients feel like their values and opinions have value and weight with a provider, I think that's another indicator of good value and of good care overall.
Yeah. It's like the value and the outcomes tend to go hand in hand. When you were talking about the example of the patient that was helped with your care coordinator, the other piece to that I was thinking of is what she's really done is interrupted the process of this patient getting isolated. Right. And that isolation leads to those things you're talking about, not feeling heard, not feeling, which then leads to worse outcomes.
Right.
Yeah.
And she felt heard. She felt like her values were taken into consideration. And certainly to get a walker and a wheelchair, it helped with her mobility, but that's not all of the value that was there.
Right.
And by allowing her that increased capacity to maintain her independence, if we had turned that off, what the outcomes could have been, we really can't predict. But I can tell you that her quality of life would not have been as good.
Yeah. So what do you find most challenging about our current healthcare system? What are the things that get in the way in your mind?
One is just how big the system can feel. You feel like you're such a tiny little cog in a giant machine. I think there's also a sense sometimes of apathy that, well, this is how the system is and there's nothing we can do to change it. It's just, this is where we are. But my pushback is always, so if I made a difference to you today, did that change healthcare? We have to start at a microcosm to build something greater than ourselves. And if something's broken, we don't just accept that it's broken. We have to start with, what is my sphere of influence? What is my next step? Who can I next impact in a positive way? And some of us do have a pretty tiny sphere of influence. Sure. And that's okay. But at the same time, think of how big that gets just with rippling.
Right.
During COVID, I did COVID vaccines. I got called up by my health department and got to go do, volunteer to give COVID vaccines in an equestrian center for, a lot of hours. It was cold, but it wasn't just the people that I was immunizing that were impacted. It was their families and friends and the community at large, and then the state at large. And ultimately, yeah, my 3,000 COVID vaccines is a tiny drop in the bucket, but everybody putting their drop in has made a big difference across the whole world. And I have to own my tiny drop was something that made a difference.
My son will forever remember the 2 retired nurses that gave him his last COVID shot.
Yeah.
They danced with him, and then everybody got hugs. Like
Mhm.
it was a really connected, community moving sort of experience.
Yeah.
Yeah.
I'm a strong believer in community, and we
Community.
all have an impact on our community, whatever that may be. It might be small, it might be big, but we all have an impact. There's my soapbox.
Sign me up.
I like it's a good soapbox. Yeah, it's good. So, just to circle us back to value-based care, in your opinion, is the move working? Is the move to value-based care working?
I think for the most part, there has not been enough financial investment in the move to value-based care. And nothing is going to move until the dollars move. Because why would they? Nobody's going to work if their check is bouncing. So the most critical thing, and the thing I've been most pleased with in Primary Care First, is that there are dollars attached to performance and to outcomes. You have so much opportunity to really see incredible financial return on your effort and on your energy in that population if you can understand the levers and the things to twist, essentially the concepts to really hold on to see value-based care work in your Medicare population. That is the number one reason that I think Primary Care First might and is working where other programs did not, because there is a carrot, there's a drive to see improvement and for patients, and there's also a path for patients to have improvement in connection with their provider.
What's the most inspiring interaction that you've had in the value-based care world? Because I think we talk a lot about the challenges of it.
Mm-hmm.
And I definitely want to hear your perspective on that. But I think starting with what's inspiring about it? What's an example of something great and impactful?
I think here for a moment, I'm just going to be a pharmacist for a second. And I have, I had some retail background. I've been in clinics with, 29 providers. So I have seen some pretty crazy things. But I think the most inspiring things are when the dollars to give patients the kind of care, the time, the dollars, the honest person to person care that I always imagined when I got out of pharmacy school. When I see that, then I know that that's the right thing. Sending someone for a repeat MRI just because they're in a different system does not meet that person to person care kind of thing. I have seen, I remember as a pharmacist working in a retail pharmacy and a mom bringing her son in. And while they were standing there waiting for their seizure meds, he had a seizure at the pharmacy. Oh. And it occurred to me that this poor kid was going to have to live with this for the rest of his life if there weren't people there who made sure that the medicine he was getting was doing what it was supposed to do and was following up. So he's there getting a refill. Obviously, the medication is not working, right? And so my role was to step in and reach out to the doctor and say, hey, you might have heard from mom. You might not, because she's pretty overwhelmed as the caregiver. But her interaction with me allowed me to provide a level of care that they maybe didn't get somewhere else. And that was the true value. The value wasn't paying for the prescription or, running it through. It was knowing that there was a healthcare provider, someone who was listening, someone who could talk to the doctor or the provider and say, hey, this is a problem. This is why this is a problem. Here's a potential solution. Really, really important in my mind. And the inspiration really came with people trusting that what I was asking for or what I was recommending was the right thing. And if not the right thing forever, was the right thing for right now.
Yeah. That's a really powerful story. And it just makes me think some of the things that you've said about value-based care, and we've talked a little bit about the complexity of the system and how large it can feel, and at the same time that one-to-one advocacy is where each of us have the ability to have that impact.
Yeah, absolutely.
In the system. Yeah. You're right. That's what makes it for me as a clinician, that's what makes it feel meaningful. Yeah.
Healthcare is delivered one person at a time.
Yeah.
And so it's the one we need to learn to care about and to make sure that we don't lose the one in everything that is.
Okay. If you could make, you can tell I'm about to like this question. If you could make one change overnight to the healthcare system, what would it be?
I think I would change access for everyone. You could get the kind of care that you wanted, when you wanted it, and where you felt comfortable being. Because until you feel comfortable receiving care, it doesn't matter how many providers are out there or how many services or how many specialists. It doesn't matter. If I'm not comfortable going to or being able to access that care, it just doesn't matter. Yeah. That would be my magic wand.
I love that one. I feel like we're having those discussions more and more. It makes me feel like the discussions we had about access 10 years ago were how many clinics are in that county? How many, right? How many providers of this type are in this area? And it's exactly what the reality is, exactly what you said. If we're going to impact those patients, they have to feel safe to be there. Right. Charles, do you have any other value-based questions before I move into sort of some of our closing questions?
Yeah, Roxanne, I want to hear you talk more about primary care first. You mentioned one challenge being that there's not this investment in value-based care, and you've been uncovering so many exciting things with this program. I want to just give you an opportunity to share a little bit more about some of the bright spots that you're seeing supporting the practices that we work with in this new exciting program.
Some of the really great things that we're seeing in primary care first is that primary care has for so long been underfunded or ignored as part of the overall healthcare success, that being able to refocus where that care is really happening and where that coordination is happening has been, first of all, a huge success. One of the other great pieces is that wellness and understanding a patient across time and space and place is really, really critical. And the wellness visit that drives that attribution allows a provider to essentially step back from all of the acute or chronic issues to get that kind of panacea type view of a patient. So the implementation of annual wellness visits has been incredibly successful. And when done really with the focus on, we're trying to see you as a whole person, creates such a great rapport between patient and provider. That's truly an impressive thing to see, and has been surprising to so many providers, because we kind of get on the wheel of we're going to do the same thing over and over and over again. And a wellness visit really gives you, like I said, that beginning to end, that longitudinal view. The thing that I hope to see is that more and more providers can see how PCF is working, and that it seems to be working quickly. CMS seems to be saving some money. That's how providers are getting bonuses, and then really allow other providers and payers to participate in that same model so that it doesn't silo different factions of patients into different care models. I think the Innovation Center is really trying to build that bridge that everybody can use, and to identify where those boards or that bridge needs to be modified for that to work well across lots of different locations, across primary care providers, and across a broad variety of patients. So I'm excited about that. I'm also excited to see practices being successful, not just with their patients, but that they're financially viable, that they're able to, have a Christmas party or have an office party where it's okay that they're all there together, and building that collegiality and building relationships between providers in a way that is really healthy and really helpful in the healthcare system. Because it doesn't have to be competitive. It allows them to be really great and yet be able to mentor a colleague. And so I think that's great. The analytics and being able to measure success has also been such a huge success. You can't change something if you can't measure it, because you can't see it. And you can't tell if what you're doing is changing it. I've often told people, if you didn't have a gas gauge in your car, how would you know when to put gas in the car? Well, I guess you could count miles, but some of us who sit at, soccer games or anything else, particularly when it's, 20 degrees, we have to have some heat. And so, if we can't measure it, we can't change it. We can't certainly change a behavior. And I love that analytics piece that allows people to see, oh, I can change that. I can influence that piece, and be able to see that week over week, month over month, quarter over quarter, and ultimately year over year. It's not a momentary change. It's a process of change.
I love that analogy, by the way. I feel like in my experiences when I've worked in healthcare prior to analytics getting more robust,
Mhm.
that the knee-jerk reaction to solve problems was always, well, the providers need more training. Right? Let's retrain. But if we're not measuring to see if that was really the issue, right? And when you extend that to your gasoline analogy, it becomes, well, let's train the Jeep to not run out of fuel. And so obviously, very similar results, probably.
Right.
Yeah, and
The provider is only one piece of that whole system. And so saying that the provider has to be responsible for everything is unrealistic, and it doesn't really maximize the skill set of everybody else on the team, including the patient and the caregiver for that patient.
Yeah. Absolutely. Bringing together your magic wand where you're talking about access. You have to think that patients are going to feel more comfortable if they're trying to access care at a location that's thriving, that's able to invest in being patient-centered, and not just, checking a box or anything, but, having the right staff, having the right, the space to think about how are we serving our patients better, outside of, how many people do I have to see today to kind of keep the lights on.
Yeah.
I have an example of that. When I worked at the clinic, we had a pediatrics office, and the rooms were pretty small because the people you're caring for are small. Not that that makes a ton of sense, but okay. And there was always just 2 chairs in the room, regardless of what age the patient is or anything. And I finally, one of the team said, what do we do when there's like multiple family members who are caring for this child? What do we do? And suddenly everybody thought, oh, well, that's kind of dumb. That's not super helpful. Why don't we put a bench in the room instead of individual chairs? And suddenly it just opened the ability for different people to engage in the child's care that may have felt like they wouldn't fit in these little tiny rooms because there were only 2 chairs and, well, now what do we do? Well, okay, let's put a bench so everybody fits, or, do things that seem really straightforward and simple, but had an incredible outcome.
Well, then on a bench, now you can have a mom and a second parent and a kiddo in a lap. And right now you have the whole family present.
Right.
If that's what they need. I love that.
Or even the clinician sitting next to the child, being on the same level with them to be able to communicate and not be intimidating.
Which circles back to her magic wand of access, the ability to meet that provider eye to eye and be heard in that way. Roxanne, I'm so pleased that you came and joined us and shared your expertise and your wisdom with us. And so I have a couple of questions that are really designed to try to pick out some gems from that expertise that you might want to share with our viewers and listeners. What trends are you watching right now?
Trends across clinics that I'm personally watching are things like annual wellness visit delivery, if that impacts their quality outcomes that we're looking at, if that impacts how effectively they're using their EMR to get electronic quality measures out. Does it impact their ability to have advanced care planning discussions, particularly for CMS patients? And any patient 65 and older, really, really important. I'm also watching very carefully how responsive and receptive providers are to their teams, and the idea generation and kind of that brainstorming that happens, not at the provider level. So are they willing to look at workflow that might change for the front desk or for their medical assistant or for their nurse manager? Or maybe it's honestly the business manager that they're asking, can we get more information about HCC coding, or can we understand more about how we compare to our colleagues or other sites? Those kinds of people who, again, it goes back to my belief, who are curious enough to say, I don't know that I can do that, but could somebody else? How can we make this work so that everybody is in the boat together in the most effective possible way? Those would be the things I'm really watching closely.
Do you have any reading recommendations for us?
Ooh, depends on what you want. I mean, goodness, I love to read. So I would definitely not suggest reading coding books unless you're absolutely required to read them. I really love Rachel Naomi Remen's books. Always have since I was in pharmacy school. She's fantastic and really humanizes medicine in a way that I often need to be reminded of, especially the further I get from patient care. I really need that reminder. There's one that Forbes recommended a long time ago called Change the Culture, Change the Game. And I really liked it. It's been a while since I've read it. Again, it's probably time for me to read it again. But particularly post-COVID, so much of medicine needs a cultural change or is ready for cultural change that I think recognizing that you're ready to change is really important, and that your organization might be ready for change in a way that they never have been before and may never be again. I don't know. We'll see.
Yeah. And with that readiness comes comes that high level commitment
Mhm.
that allows practices to really see results in ways
Yeah.
that they hadn't before, I think.
Dream big.
Dream big.
Dream
yeah.
big.
Okay,
Doesn't
so
mean I'm going to have a Ferrari.
I got one last one. Who would you like to see us have a conversation with like this?
I would love to interview people who feel like value-based care hasn't worked for them and see what they would suggest to be different. I would really love to hear from people in an ACO environment where they have lots of different kinds of practices and what they see as strengths and opportunities within their organization, and even down to the individual practice level. I would really love to talk to, if I could ask anybody, I would love to talk to people who are interested in healthcare innovations.
Yeah.
What are they willing to try that is outside of the box? And why do they think, what are they seeing that is working outside of the box? And how are they going to fit it into the system that they have? Those would be some of the people.
How are they going to measure the effectiveness of that innovation? Yeah,
right.
That's a great idea.
Can they measure how to really implement it? If there's not a cheerleader standing, if they're not the one, kind of shoving everybody forward, what is that? What needs to drive that change and that opportunity? Yeah. So those are some people, and it may not even be people in healthcare. It might be people that are on the business side. What is it that they're really looking for before they're ready to change, or they feel like they need before they can make big adjustments.
I'm curious, if people want to get in touch with you, Roxanne, what's the best way to do that?
The very best way to get a hold of me is to send me an email. I love to see new information or new questions coming from people. Sometimes I can't answer it right away, but I love the opportunity to do a little research, learn something new, and hopefully be able to help. And, it broadened my circle a little bit. So please reach out by email. Phone call is a challenge between all of my other responsibilities. So definitely shoot me an email. If you want to have an in-person conversation, let's connect by email and make that happen too.
All right. Well, we heard it here, and we'll put that in the notes, your email address. Folks can explore, stay curious with you, and explore innovation that's happening not only for them in their setting, but also how it connects to the broader system that we're all a part of.
Thank you so much, Roxanne. I really appreciate you taking the time.
Absolutely. It was fun.
Thank you for joining us for this episode of In Search of Value. Mingle Health is your partner in the transition to value-based care. We help healthcare organizations save time, improve quality scores, enhance patient outcomes, and increase reimbursements from value-based programs. If you'd like to speak with one of our value-based care experts, you can contact us at minglehealth.com.